Dr. Nate here. This is a special episode for all of you nurses. A lot of nurses struggle with back pain, and I'm going to teach you all today how to protect your back to either prevent you from having really debilitating back pain from patient care, and to just give you health for the long run. A lot of nurses will wash out because of back issues. Same thing with PTs, actually, which is interesting. And a lot of healthcare providers. So this is really important information to know. We're going to go through three things. Okay, there's more, but I think these are the three keys. So I'm looking at my notes. Number one, lift weights. If you're not lifting weights already, you need to lift weights. I'm just going to be very, very clear and straightforward. You need to lift weights. If you don't like lifting weights, I don't know what to tell you. You need to lift weights, because if you're doing transfers with patients and you're in a time crunch, sometimes you're going to have to move people, and you're going to have to lift things that are not patients. And so it's going to be important for you to be somewhat strong, probably stronger than the general population. So lifting weights, super important. My favorite exercises to give to my healthcare workers who are doing transfers and lifting items are bent over rows and deadlifts. So if you can work on bent over rows and deadlifts, so working on general overall strength with deadlifts, and then erector spinae, that's the muscle group, and mid-back muscles through using bent over rows, that builds the endurance of those muscles because you are sustained in that posture. I'll make a video of what bent over rows look like and all that type of stuff later, but those are the two exercises to help protect your back, in addition to lifting in awkward positions too, because sometimes you can't get into a good position to work with a client. You can't get into a good position to lift a patient appropriately, or lift some box or some piece of equipment. So sometimes you actually have to practice lifting heavier objects in awkward positions, almost like strongman training. This is stuff that, yes, it sounds weird and kind of dangerous, but think about it this way. If you can lift heavy objects awkwardly and you do that in your training, you're less likely to have an injury. Your body is more likely to be prepared for the demands of your job. So this is just called general physical preparedness, GPP. Thank you, powerlifting and strength and conditioning, for that term. But those are really important. Number two, after lifting weights, is your lifting mechanics. So when you're able to, work on your lifting mechanics. So, this will change depending on how you're trying to lift the individual. But if you get good at deadlifts and you get good at squats and you work on your mechanics, there are optimal mechanics for lifting the most amount of weight. Now, ideally, if you have a client who's really heavy, you're just using a lift. You're not lifting them yourselves, like you're using a Hoyer or using one of the mechanical lifts to help, or a 2-person or 3-person lift. It's not just you. I know some hospitals and nursing facilities don't have that, but still, that's an option. So working on deadlifts, working on squats, and then also practicing lifting mechanics are really important. I know that schools go over this, but I'm telling you, from a PT standpoint, it is important. And then I have a client coming in soon, and then prioritizing sleep. So I know you work long hours. I know that it's hard to balance your work and your sleep schedule, especially if you have a family, but this needs to be a priority too. If you're chronically sleep deprived, then your recovery will be worse. You'll be at a higher risk of sustaining an injury. So it's really important to focus on optimizing your sleep too. Hope that is helpful. So number one, lifting weights. Number two, working on your lifting mechanics. And number three, prioritizing sleep when you can. Those are the three top things I would recommend to you nurses. As always, get strong, live well, and hope this was helpful for you all. Please leave a comment in the comment section below if you have any questions. I would love to hear from you, and also like and subscribe. Smash that like button for me and share this around to all your nursing friends, as it's going to be hopefully very helpful. See you later.